Already? Good? Okay, so I'm going to talk to you today about instrument-assisted soft tissue mobilization. Before this semester before, I didn't really know a whole lot about it. We learned about it a little bit in rehab modalities, but I really got into it at my last rotation because they used it a lot. What is this? So it can be used precisely to detect and treat soft tissue dysfunction and restore range of motion while reducing the stress on your hands. So instead of using your hands for manual therapy, you'll use this tool, which a lot of you guys have probably seen. You've heard of it as Graston, most likely. Hawk grips. There's all different sorts of. I just realized my words are cut off. Sorry. Anyways, so how is it used? So after injury, your cells are laid down in a disorganized manner, as we know through rehab and modalities. Scott says they're laid down like noodles and not in an organized manner. So what this does, it introduces micro trauma to the area, so basically like tiny little injuries. So it creates a local inflammatory response, so the cells are laid down in a better way, in an organized way. So the scar tissue can be remodeled so that cells become organized in a direction that promotes movement. So this is a picture. As you can see, this is healthy tissue on the far left. It's pre-injury. This is injured tissue in the middle, and then healed tissue. As you can see, this is not really organized on the far right. And so what this instrument-assisted soft tissue mobilization does is it lays it down in an organized manner. So what are the benefits? It breaks down collagen fibers, decreases overall time of treatment, reduces the need for anti-inflammatory medication, and resolves chronic conditions. So what are some conditions treated? So it's tendinopathies, ligament pain, myofascial pain syndromes, entrapment syndrome, scar tissue adhesions, and edema reduction. Most of what I saw when I've been using this is tendinopathies. We use this in pitchers a lot. I saw volleyball players with patellofemoral stuff. That's most of what I saw. I didn't really see much else. So what is a typical treatment session? So you warm up the tissue, on a bike, running, jogging, whatever it may be to, heat up the tissues. You perform this, usually takes less than 2 to 3 minutes. And then after you're done with the treatment, you engage in a light exercise to promote proper movement patterns. As you can see here, he's using this down at the Achilles tendon. And so what to expect? You're re-injuring the site at a lesser degree, so the athlete's going to have some mild discomfort. Sometimes there is soreness and bruising, but if there's severe bruising like in this picture, that's not okay. But some soreness and some mild bruising is okay. So how often do you want to treat this? You want to do it two treatments per week, 3 to 4 treatments. By 3 to 4 treatments, you should feel a difference, but you don't want to do this back-to-back days. You want to have a day in between. So what are contraindications? Cancer, burn scars, pregnancy, open wounds, infectious diseases, and hematomas. So what I was really surprised by is the price of these. As you can see, Graston, which is like the big name, I think they were the first ones to come out with it. So a 6-piece set, which is this picture here, is $2,295. That is probably why we don't use it here very much. Anyways, so Hawk grips is what I used a lot at my site, and a 6-piece set for that is about $2,000. So that's also why we don't see it a lot. This is the knockoff brand, as they call it. So also what I found was very extensive is the certifications that you have to use Graston. And to be Graston certified, you have to go through the M1 and the M2 course. So the first course is 12 hours, excuse me, and it's $650. And then the second course to actually become certified after your first course is 14 hours, and it's $695. These can be used for CEUs, but they're very expensive, as you can tell. And then I couldn't find anything on Hawk grips on their prices of being certified, but these are my references.